Good day, e-learners. Today we're going to start a program called Supporting Success, How Workplace is an Opportunity for Wellness. Let's begin. This program is put on by Access California. Access is a program of Cal Voices, and we are the consumer-led stakeholder advocacy program funded by the California Mental Health Services Act, also known as Prop 63, passed in 2004. And it's operated by the Mental Health Services Oversight and Accountability Commission. Our parent organization, Cal Voices, was founded in 1946 and is the oldest continuously operated consumer advocacy agency in California. We are a peer-run organization that specifically hires peers with lived experience. Access is an anagram for advancing client and community empowerment through sustainable solutions. We act to advance client and community advocacy to sustain solutions towards mental health policy. So we have three strong values for our program. They include advocacy, recovery, and peer support. Advocacy is about meaningful stakeholder participation and the active solicitation of community feedback to expand opportunities for involvement, and this is to be included in all levels of decision making, including policy development, program planning and implementation, service delivery, oversight, and administration. When we're talking about recovery, we mean the infusion of recovery principles in all aspects of service delivery. That's recovery-based training and support for mental health professionals, with the tracking, reporting, and analysis of recovery outcomes in all mental health programs. And finally, we stand by the value of peer support. This is with the fidelity to an evidence-based model that's evidence-based and tested, and incorporates the expansion in all mental health programs and the promotion of living wages, ongoing professional development, and opportunities for advancement in those peer support roles. Today, we're talking about workplace wellness, how workplace environments add to the wellness and recovery of mental health clients and consumers. We're going to talk about and learn about the importance of social support, the psychological risk factors of work, challenges to developing a healthy work environment, and how to overcome some of those challenges. So let's first start with a discussion about making the case for why workplace is an important aspect of recovery and how it can add to the wellness and well-being of consumers and clients. A psychologically safe and healthy workplace is one that promotes workers' mental well-being and does not harm employees' mental health through negligent, reckless, or intentional ways. So what we were looking at and why do we work is because working provides protective factors. Working supports recovery and the maintenance of personal well-being. By getting a job and staying employed, you're contributing to your own recovery. Employment is an important social determinant of health, and our participation in employment can enhance health and well-being. Unfortunately, the majority of individuals with serious mental health conditions are unemployed. Unemployment rates among those with serious mental health challenges range between 80 to 90% across the country, making this group one of the most recipients of Social Security in the United States. This is unfortunate because most people living with a diagnosis desire and can work, but they are excluded from the workplace because of stigma. For those with mental health conditions who are in the workforce, there are issues related to sustaining their capacity for productive work. So, there is no empowerment without employment. Working supports recovery by providing routine, activity, identity, purpose, contribution, connection, social support, resources, and independence. These are all things that contribute to mental wellness and overall health. Here is a bit of data from the Bureau of Labor Statistics from the American Time Use Survey. You can see that over 38% is working and related activities, in addition to the sleep, eating and drinking, leisure and sports, and household activities that round out the majority of Americans' days. So we want to reiterate that it's important to find a healthy work environment. And why is this so important? An unhealthy work environment, it has negative effects. It can reduce productivity, it has financial challenges, workplace morale changes, relationships change and overall health can change as well. Americans ages 15 to 54 reported that 18% of those who were employed say they experienced symptoms of a mental health disorder in the previous month. A person's work environment affects everyone around them. According to the Work Health Survey by Mental Health America National, you can see the top 5 reasons for happy employees. That include the relationships with their coworkers, the contribution of work to an organization's business goals, meaningfulness of the job, opportunities to use skills and abilities, and the relationships with an immediate supervisor. Those all contribute to very healthy work environments. And some of the top 5 reasons for leaving a job include minimal wage growth, lack of opportunity to advance, excessive overtime hours, a work environment that does not encourage teamwork, and a boss that doesn't allow you to work with work flexibility. These are things that contribute to an unhealthy environment. Today, we'll be mostly talking about peer support roles and peer support in the workforce. So what we're talking about and why it's so important to address is that peer staff are more likely to be affected by an unhealthy work environment. They are workers with disabilities and they are overexposed to risk, including stigma and discrimination, limited career aspects, pay and benefits that don't grow or stay minimal, and demand and control imbalances. And there are also role conflicts. Could you think of any others that contribute to an unhealthy work environment? Let's take a moment and address the role of employees. Employers may provide a foundation of support, but employees keep it running. When everyone feels a responsibility, the culture thrives, and people take personal responsibility and lead by example, take initiative, and build a support network within their co-working environment. So work and a supportive work environment can reduce the onset, severity, impact, and duration of a mental health disorder. So while in a supportive working environment, you might notice that work challenges seem more manageable. There's increased job satisfaction, you encourage self-care, support social relationships at work and among coworkers. There are lower effects of stress, reduce healthcare costs, and improve overall health. So we started with part 1 that was about the case for why working is good for mental wellness. Now let's also talk about the psychosocial risk factors. These statistics and the risk factors listed are taken from the Canadian Centre for Occupational Health and Safety. Let's start with the psychosocial factors of work. These are elements that impact employees' psychological responses to work and work conditions, potentially causing psychological health problems. This includes the way work is carried out and the context which work occurs. We'll start with a list of all 13 psychosocial risk factors. For this presentation, though, we are only going to focus upon psychological support, organizational culture, civility and respect, recognition and reward, workload management, and psychological protection. You'll be able to find other information from the Canadian Centre for Occupational Health and Safety on all the others. Now let's take a moment and address each risk factor independently. So we're going to start with psychological support. This is coworkers and supervisors are supportive of employees' psychological and mental health concerns and respond appropriately as needed. For some organizations, the most important aspect of psychological support may be protect from traumatic stressors at work. An organization with good psychological and social support would be able to state that workers feel a part of a community, employees intervene if a coworker looks distressed, workers feel supported by each other when they are dealing with personal or family issues, and employees support coworkers who are returning from work after time off due to a mental health condition. And people in an organization have a good understanding of the importance of worker mental health. So what does this practically look like? This includes having access to helping relationships, being interested in each other as people, assuming good intent in all your coworkers, intervening if a coworker looks distressed while at work, and feeling cared for and appreciated while in the work environment. In the workplace, there are various different types of support. There's instrumental or practical support, which is offering help or assistance in a tangible or physical way. There's also emotional support, acting as a confidant for someone or listening or offering sympathy or empathy. And informational support, which is the provision of information. For the individuals that want to increase social support in the workplace, the first step is to create positive relationships to others. This can be done by adding one or more persons to one's own social network or by strengthening existing relationships. Social ties with others should be characterized by mutual appreciation, at least by the absence of antipathy or a little bit of animosity. Further, the individual should be aware of the concept of reciprocity, and more specifically, in order to receive social support, the individual should be willing to give social support. Another step to articulate a need of help, which means seeking and asking for help, and appreciating support efforts from others. We will pause here for a quick video. On to risk factor number 2, organizational culture. This could be how things are done around here, the kind of overall sense about a workplace, the personality of the overall agency, and include shared attitudes, assumptions, values, and beliefs that influence behaviors and shape expectations of others. When we're talking about levels of organizational culture, there are 3 levels to understand. It's the assumptions that reflect the beliefs about human nature or reality, the values that show strategies, goals, philosophies of an organization, and then the artifacts, the visible, tangible aspects that include physical artifacts, as if it was an archaeological dig. Strong organizational culture includes clear goals, rules, and values, effective communication, conflicts that are dealt with effectively, efforts, reward, balance, accountability, and respect for each other's ideas, values, and beliefs. There's a clear organizational objective. And on the flip side, when organizational culture is lacking, there's poor communication and low levels of support for problem solving or development, and poor managerial support. Bullying is also a prime example. Approximately 2 out of every 5 people have been bullied at work. Almost half of those targeted at work suffered stress related to health problems. And the bullying can be verbal, psychological, physical, or online. It can also include blacklisting from future employment opportunities. And additionally, there's the lack of definition or the agreement or an organizational objective. We're going to jump to risk factor number 4, civility and respect. Employees are respectful and considerate in their interactions with one another, as well as the customers, clients, and the public. Civility and respect are based on showing esteem, care, and consideration for others, and acknowledging their dignity. Civility and respect in the workplace can be as simple as treating each other with dignity, courtesy, politeness, and kindness. You treat each other fairly and acknowledge each other's strengths and contributions, and encourage expressions of opinions and ideas, also known as the Platinum Rule. When civility and respect are lacking, you'll notice bullying, mobbing. Mobbing is considered intentional or non-intentional verbal or nonverbal conduct by one or more individuals against another individual, continuously or systematically over a period of time. In addition to humiliation, unnecessary conflict, resentment, retaliation, and emotional exhaustion. So if you find yourself in one of these positions, this is one way to overcome, a few ways to overcome it, is to focus on yourself. What you need to do is pursue personal growth, acknowledge but don't dwell in the negativity, and try a new skill, hobby, or sport. You can find a new mentor or supervisor, and build a support network at work. Remember, your physical health is always important, and try to key in on that and how to build a better body. Jumping ahead, we're on to risk factor number 7, recognition and reward. Appropriate acknowledgement and appreciation of employees' efforts in a fair and timely manner include the recognition. This includes appropriate and regular financial compensation, as well as employee and team celebrations, recognitions of years served, or milestones reached. These are the ways to provide people with a little bit of substance for their recognition and reward. So as a coworker, you can take steps to do this in your own workplace by acknowledging and appreciate your coworkers' contributions and celebrate individuals and shared accomplishments. You can value individual commitment to work, celebrate milestones, say thank you for most of the things that you do and get, and publicly recognize each other in emails or other in-person meetings.
I know what's happening here. My mom called up BuzzFeed and told everyone to say nice things to me, right?
So here's how it's gonna work. I'm gonna go and give the first compliment, and then that person is gonna go and give somebody else a compliment. It's gonna be a compliment chain. I actually want to tell you that I think you're great.
Thank you very much.
You have such positive, beautiful energy.
Okay, this is gonna take a dark turn fast, isn't it?
No, and I love your work and what you do and how you make people feel special in the office.
Thank you so much.
So here's the thing. You're gonna have to go and compliment somebody else. So who do you want to compliment?
I want to compliment Steph. You just started working here and you've been like guns blazing, working hard and motivated and like with like a really positive attitude and like a non-stop smile.
Can we hug?
If we can hug.
Oh, Ricky. I just wanted to let you know how great you are, and I hope your greatness rubs off on me.
Aw, that's so cool.
I actually rubbed myself.
You are such a kind and caring person. And when we were both interns, you sat across from me and answered any questions that I had, and you were really helpful. And I'm very glad that we're friends.
Aw, Ken. That was so nice. I think you work really hard.
Oh, thank you.
And I think you put everything you have into all the work you do.
Thank you.
And I just like really wanted to applaud you for that.
Thank
I appreciate you, and I'm glad you're here.
I wanted to thank you for being such an amazing person. You always help me when I need help with a bunch of shit. And I just wanted to say you're a very sweet man, and you're very beautiful, and you're very nice.
Hey, Shane. Hey. You're beautiful, and thank you. I just want to thank you for being you. Just give me a hug, yeah. Oh.
I thought of someone I wanted to compliment. I want to compliment you.
Thank you.
I'm always thankful for your positivity. You're one of my favorite people around this office. And I just wanted to tell you that.
Thank you. I feel the same way about
Give
you.
a little hug.
I wanted to say that thank you so much for being my friend, and you inspire me every day.
Oh my God. You're the best.
Now I feel really happy and warm. You're the best, Chris.
Thanks.
Moving along a little bit faster, we're on workload management. A large workload is often described by employees as being the biggest workplace stressor, having too much to do and not enough time to do it. It is not only the amount of work that makes a difference, but also the extent to which employees have the resources, including time, equipment, and support to do all their work well. Here are some of the key factors that you'll notice when people have an appropriate workload management system. They have high performance, fewer mistakes, opportunities for innovation, feeling fulfilled through their work, and offering to assist with tasks that individuals feel overwhelmed, and maintaining a balanced work life. Contrast to that, when there's too much imbalance in workload, you're overworked, and you have high levels of time pressure, continually subject to deadlines, feeling inadequate, presenteeism starts to falter, which is attendance and things of that sort, stressing about work at home, and fatigue and family conflict. The last risk factor that we will address is psychological protection. This is when an employee feels able to put themselves on the line and able to ask questions, seek feedback, report mistakes or problems, or propose a new idea without fearing negative consequences to themselves, their job, or their career. They actively promote emotional well-being among employees while taking all responsible steps to minimize threats to employee mental health. That's part of the organizational culture. So when there is good psychological protection, there's an ability to be yourselves and a care for each other and coworkers. Being comfortable to report situations that can threaten or harm workers. Safety is taking risks, and safety in reporting issues and problems, and there's always constructive conflict. So how do we build psychological protection in workplaces? It's important to frame conflicts as opportunity and understanding and learning, to acknowledge fallibility and invite contribution where I may miss something, where I would appreciate any feedback you may have, and to model curiosity and ask a lot of questions. For the purpose of this presentation, we focused upon psychological support, organizational culture, civility and respect, recognition and reward, workload management, and psychological protection, and how those play into psychosocial risks for peer support workers in the mental health field. We're now on to part 3, the challenges to changing work culture and to strive for better mental health workplace and needs. The number one challenge to change is often leadership. That's because sometimes they can push off responsibility, avoid difficult conversations, and be rather ineffective or have a hands-off philosophy. This means that there's generally lack of effort in developing good workplace mental health. As peer support staff and those with lived experience, often challenge number 2 is stigma and discrimination. This can appear in a number of different forms as discrimination in mentalism, macroaggressions, microaggressions that include low expectations, marginalization, or tokenization. And these are all things that put down people with lived experience. Challenge number 3 includes workplace stigma and how it relates to workplace culture. And the assumptions of underlying workplace stigma include people with mental health problems lack the competence to meet the demands of work, or people with mental health problems are dangerous or unpredictable in the workplace. Also, working is not healthy for people with a mental health problem. And providing employment for people with mental illness is an act of charity. Challenge number 4 is culture. Not in reference to an organization, a workplace, or an office culture, but more specifically to diverse communities that are from around the world. Not all employees will have the same issues. Age, cultural, gender, family and marital status, and caregiver demands, socioeconomic status, and many other factors affect an employee's work. Working across cultures requires us to understand people who have very different perspectives and experiences. Challenge number 5 that peer support workers often run into is role confusion. Being placed in a clinical model through most behavioral health systems, there's little understanding of how the peer role fits into the mental health system or service provision. Our last challenge, number 6, is communication style. We've all run into instances of miscommunication, where some people don't communicate enough, or some too much. And then there are assumptions that are made, our tone of voice or our volume changes dramatically, our nonverbal communication can be unclear, or there's value judgments placed in the way that we communicate to one another. All right, we're in our 4th and final section about overcoming some of the challenges that were listed before in section 3. Some might start to wonder how they can change these things or why even bother to change these things. To be honest, there's always a better chance of promotions, better relationships with coworkers, increased job satisfaction, a reduction in stress, and a focus on opportunities rather than problems that come with addressing these challenges head on. To address challenge number 1, you want to talk with somebody that you trust. You want to find ways to empower yourself, improve your relationships, and express your needs clearly with the leadership that is involved. Overcoming stigma can be a challenge, and that helps by modeling recovery at all times. That includes learning and sharing facts about mental health, treating people with mental illness with respect and dignity, avoid labeling people, and support people, respect their rights, and teach children about mental health. This is when you're going to get the best results of overcoming stigma in a gradual manner. You can also name mentalism when it happens, when someone is discriminating against that, and to strategically respond to stigma, whether or not intentional, and inform and educate others, as I mentioned before. Challenge number 3 was culture, as in diverse populations. And that includes how to embrace culture is to overcome it. To be aware of your own culture and the way that you provide your own perspective, and find things in common and find the value in the differences that you have. Utilize talents and skills to be able to work together, and encourage sharing and recognize and appreciate each other's backgrounds and the special spaces that it encounters. Challenge number 4 was overcoming role confusion, and that means to understand the principles of peer support and key recovery concepts. You want to model recovery at all times, maintain appropriate interpersonal boundaries, educate people about your role, and review your job description so that you understand what job you are there to do. Miscommunication is a tough one to solve. However, there are some tools to be aware of to address it in a better way. You can try to be more self-aware about the way that you address your own communication skills and presentation. Remain non-judgmental, set clear boundaries, be fully present in your conversation, and watch your body language. Be direct if it's appropriate, and find out how coworkers prefer to communicate, and you can just ask them. Finally, when all else fails, challenges are best addressed by being your authentic self. Authenticity is a choice, and authenticity drives connection with yourself and with others. Authenticity is hard, and it requires courage and support and empowering yourself and others. Authenticity is not a firmly held conviction that you always feel or always had valid, and it is not your opinion is always relevant.
I believe we live in a society of conformity, a society that expects us all to be the same, to act the same, to look the same, to feel the same. And what we know from this experience around conformity is that it doesn't work, that people feel unhappy, they feel disengaged, that employees feel disconnected from their work environments because conformity doesn't make sense. It's not natural. We are different people. We come from different cultures, we have different personalities, and the key thing is to embrace those differences. I truly believe that when you bring your whole authentic self to interactions, you invite others to do the same. And so with authenticity, it's important for you and your own benefit, for your own growth, that you live truest to who you really are, because you will be happiest when you do so. But more importantly, in this interconnectedness of being, in this state that we are all part of a global community, we must be authentic in our interactions because it helps others to be more authentic. And through this better connection with ourselves, we can help others to feel not only connected to themselves, but to others as well. And so authenticity, in my view, is one of the key core competencies for professional leadership, but personal leadership as well, for personal growth, for happiness, for engagement, for empowerment.
We'll pause for a quote from Mark Twain. "The secret of getting ahead is getting started. The secret of getting started is breaking your complex, overwhelming tasks into small, manageable tasks, and then starting on the first one." I feel like that's good first step advice. Today we talked about workplace mental health and the importance of social support in workplace environments and how it builds to mental wellness. That included the importance of social support, psychological risk factors, challenges to developing a healthy work environment, and how to overcome those challenges. Here are some ways to find us on the web. Please feel free to reach out. Thank you for joining us.